Good morning and welcome to our live stream event. I'm Marta Rañón with Southern Caregiver Resource Center. I invite all of you to grab your cup of coffee, your tea, your juice, your water, and of course, a notepad and a pen so that you can jot down all of the wonderful information that you are going to be hearing today. Our live stream event is entitled Who Me, a Research Volunteer. And this topic is really important. I'm so glad that we're talking about this today because a lot of us who have been caregivers or who are caregivers for someone who might have dementia, memory loss, Alzheimer's, often are wondering, when is this magic pill going to come our way? When are we going to find medication that is going to help our loved ones kind of stave off some of the side effects of memory loss? And in order for us to get there, we need the research community, right? We need to have the clinical trials. We need people to be involved so that we can further study and further do research to lead us to the point that we can find a cure for these diseases. And that's why today I am so excited to be talking about this. Before I introduce our guest, I do want to mention, in case you are not familiar with Southern Caregiver Resource Center, we are a nonprofit organization that focuses 100% on the family caregiver. That's right. You who are here and who might know someone who's a family caregiver, have them join you today and share with them this vital information that you're going to be hearing. If you are caring for someone who is over 18 with some sort of cognitive impairment, like I said, dementia, memory loss, Alzheimer's disease, or caring for someone over 60 with some sort of a chronic condition, or who is frail and elderly and needs more and more assistance for their daily activities, then we are here for you. You can visit our website at www.scrc.care. It's right there. Also, www.caregivercenter.org. It will lead you to the same place. Or you can give us a call directly at 858-268-4432. Again, if after today you think, wow, this is something that I want to get involved with or connect with, make sure you give us a call and you do that today. I have the great privilege now of introducing a dear friend of mine who I think is just so wonderful. His name is Mike Splaine, and he is the owner and principal of Splaine Consulting. He has been working in the field of health and long-term care since 1988 and has a proven track record of helping organizations achieve success in advocacy for health and long-term care issues. He helps lead clients to successful policy change by combining his deep knowledge of policy and program development and management with his skills in public speaking, community organizing, adult education, media strategy, and public health communications. Mike Splaine established Splaine Consulting after more than a 20-year career on the public policy and advocacy staff of the Alzheimer's Association. And fun fact, that's where I met Mike, and that's where we used to work together. And it was such a thrill to be able to learn from him. He is also known worldwide for bringing the real face of a problem into the policy arena to yield success with policy influencers. So at this point, I'd like to welcome Mike, who is here today and ready to share with us a whole bunch of information about research and updates. And welcome, Mike.
It's good to see you, Martha. It's been too long. Not just COVID. We're bi-coastal. I'm coming to you from my
Yes.
home office here in Columbia, Maryland, just north of Washington, D.C. The topic today, I think, is especially poignant. I think you set it up correctly that it's only through participation in a variety of types of research that we will have progress both on social care and on therapeutic treatments. And as we've seen, for example, just firsthand, the wonderful tens of thousands of people that volunteered for COVID vaccine uh, clinical trials, the pace of being able to attack something like COVID was absolutely affected by people's essential good heart and willingness to be part of science. on a very personal level. So we're going to talk about it with regard to memory loss, Alzheimer's disease, and dementia. So my magical slide producer should be bringing up my slides, if I understood correctly.
And I want to invite our
And
audience that if you have any questions as we get started, or towards the end, feel free to put them on the box there, and we will address them and bring them up, and hopefully get your questions answered.
so perhaps I misunderstood the producer.
It happens, Mike.
I know. Well,
the beauty the beauty
should I
of
bring up
doing this
live
online.
technology? There we are.
Oh,
So, in addition to Splaine Consulting, I'm the owner and principal of a company that's called Recruitment Partners that is completely focused on uh, making it more possible for people to participate in research. So, who me, a brain research volunteer? Next slide, please. So it's only proper to disclose to you my financial relationships. I'll tell you who we work with, but I won't tell you how much they pay me. But I think this is just a matter of record. And of course, next slide, none of these clients have directed this talk. So where are we going to go today? I want to start with a review of our images when we say the word research, or we say biomedical research. From there, I really want to just, without getting technical, but I want to take a little bit of time talking about the various ways in which humans who participate in research of all kinds are protected, and then hopefully give you some key vocabulary words so that if you should decide to inquire or to participate in research, you know what some of the words that get thrown at you fast and furiously. I want to, from there, just talk a little bit more about how vital individual participation is, give examples of studies, and then take questions. And as Martha said, no worries, put questions in the chat. We have plenty of time for questions and answers at the end of our talk. So what is our most typical view of research? Horrible view of research gone wrong. Next slide. Yeah, there you go. Right, right. I mean, sometimes when we think of research, we think of it as something that's negative, it's destructive, it's somehow secretive and horrible. But in fact, it's not. Next slide. There are many different kinds of inquiry into testing treatments. And I think one of the things that is wrong with the Alzheimer research establishment today is that there's a real focus on certain kinds of research to the detriment of presenting a menu of research. When we think about research, we think about a clinical trial, that is a test of a substance to see whether or not it has a benefit to people with a certain disease or condition. I think the most common thing that people think about volunteering in research is volunteering for some kind of a clinical trial in which they will be tested with a pill. Pills are probably the most common form of clinical treatment that we have on the planet today, and there's no reason to think that that's going to change anytime in the future. But there are other kinds of research. For example, next slide, we see enormous amount of progress, and in fact, the most recently licensed amyloid removing drug in Alzheimer care is an infusion. Cancer treatments are frequently infusions as well as others. It's just another way of delivering a substance into bodies that may make it more easy or tolerable for people to be a part of. And again, before this ever gets to being used as a treatment, there have to be a serious effort to test whether or not it's safe, whether or not it's effective, whether or not it does not create harm. Next slide. We also have clinical trials of devices. I happen to have a pacemaker That's a new one since I saw you last, Martha. And this pacemaker that keeps my heart going like this instead of like this is the product of over 300 people voluntarily wearing a device and putting it through scientific rigor to make sure that it was both safe and effective and did what it was supposed to do. And that's just one measly pacemaker. Almost all the medical devices that we use in the United States in order to be licensed go through some form of clinical investigation, safe clinical investigation. Next slide. Um, Less known is in the United States today, there are the same level of clinical testing that we do for pills, infusions, or uh, devices. We are putting care and support interventions through those same kind of clinical tests. That is, we're getting a sample of people, giving some of them the opportunity to participate in, say, something like a caregiver education program, and others would only get ordinary care and support, and testing in to see whether or not something is strong enough in terms of its effect on people, the caregiver or the person being cared for, to see whether or not it can be called an evidence-based intervention. These trials are frequently completely underrepresented and have a really hard time recruiting. I argue it's because medicine is glitzy and care and support is not, but you may have your own ideas why care and support interventions chronically don't have enough participants. Next slide. Um, Sorry, Office. The Office was a pretty darn good movie, reminding all of us if we could just take a survey, but a very low risk but high impact form of participating in research, if you think about yourself as a possible research volunteer, is to do surveys. Surveys assist in a lot of ways. For example, we're all familiar with the quick and dirty red light, yellow light, green light survey, that whether that's at the bank, the TSA, or the grocery store, it's a form of collecting information from a knowable group of people to provide feedback and knowledge about a particular service. Um, Everything from those 3-button surveys to long, complicated cognitive tests and surveys online all contribute to human knowledge and all give us some perspective. Let me just say, I'm talking to folks mostly in and around San Diego. Um, One other note about who me or brain research volunteer is that the big challenge in research today, particularly aging related research, including this form of research, surveys, is the underrepresentation of people that are Latinx, as well as African American and American Indian. It is a chronic problem. It's a very important problem, and as you read in my introduction, I'm all about getting the voice of people into the policy and research process. I have to say that one of the big gaps in Alzheimer's research of all kinds today is participation by Latinx people, and we've made a point of making that an important part of our work with recruitment partners. Next slide. Uh, Not often thought about unless people are directly affected or asked. Funny thing about research volunteering, just like any other volunteering, you know what the number one reason people participate in research? Somebody asks. Isn't that funny? Just like other volunteering, somebody has to ask. Tissue donation, whether that's participating in giving a small sample of blood so that we can track down the antibodies that are developing in the population because they're exposed to COVID-19, or it's full brain or other tissue donation. Tissue donation is widely accepted judged to be a moral act by all the major religions, and has strong, strong support for organ and tissue donation for research across the entire American spectrum. But it's not often thought of, and frequently people go unasked that have diseases or conditions that have tissue banks and other ways in which people will, can participate. Next slide. So it's a menu. Everything from a survey online that's relatively easy to do and relatively painless and may actually get you some kind of a thank you or gratuity, through testing, offering your tissue, cognitive tests online, validating new ways of testing people's thinking, and as I pointed out, on and offline supports for people living with dementia, medical devices, infusions, pills, and injections. These are kind of the hierarchy or a menu approach to thinking about research opportunities. So when you hear the who me, a brain research volunteer, the picture I'd like you to have is a menu, that it isn't just one particular kind of research, pills and injections, infusions that might be very, very challenging to do or scary to do or risky to do. There's a number of other high impact, low risk ways in which you can be involved in research. It's a menu. Next slide. Let's talk about safety for a minute. All right, next slide. I got my fun slide in. By the way, it's a rule that every Facebook or live stream or Zoom presentation has to have at least one funny slide in it. I don't know who made that rule up, but I try to follow it. But I will tell you that in all forms of research, human subject research today, protecting the humans that are involved in it is a prime directive. People lose their licenses and get jailed when they screw this up. So what are the protections that we have if we choose to participate in research? The first and foremost is that we only participate in research if we have given our informed consent. Consent meaning that knowing what is knowable about the experiment, whether it's a survey or a pill, knowing what it is about the experiment that I'm about to be a part of, that I'm well informed about the risks, the potential benefits, and who's behind a study, that informed consent is the core of the protection of human beings participating in research. That you have to be informed and literally have the documents involved in giving your consent to participate in research and time to study them. Frequently, they will be in more than one language. If that is an issue, if people are monolingual, Spanish speaking, for example, a number of Alzheimer's trials provide their informed consent in Spanish, or even when you get up towards San Francisco in Russian, we've seen some informed consent forms in Russian for that community, which just kind of surprised me a lot. I didn't think about Russians in California, and I suppose I thought should have. So the first protection is that we give our informed consent. Even to be part of online surveys, there is a consent form. I happen to have something called polycystic kidney disease, and I am part of a registry. That is a voluntary registry of people with the same disease. And to join that registry and to get surveys on a irregular basis from the Polycystic Kidney Disease Foundation, I had to give my informed consent. So if you're worried about, am I going to be safe? Is my information going to be protected? Informed consent covers that. Then, if that wasn't enough, regulators, mostly federal, mostly the Food and Drug Administration or the National Institutes of Health, provide direct monitoring and oversight of both the design and the implementation of clinical trials of all kinds. So there are, and in addition to that, in the informed consent document and regularly in the course of participating in any kind of research, participants are provided a direct contact to be made 24/7 in case there's any kind of an adverse event involved in the research. That could be anything from people who have skipped a dose or forgotten to take a dose that are in a clinical trial to unusual side effects that occur. Uh, Seems like these things always happen in the middle of the night, and you necessarily have to have a direct contact in any clinical trial. You have to are provided a direct contact in case of any adverse event, because following the directive of protecting our human subjects is so important to everybody. Another set of protections is that we take a phased approach, especially with drugs. You may have heard the phrase, particularly with COVID, we've all heard phase one, phase two, three clinical trials. What do these mean? It means that we take a stepwise approach to testing drugs or vaccines or infusions that are intended for human use. A phase one trial is usually a very, very small number of volunteers, and it's really a basic test after probably laboratory animals or other testing of a substance to see whether or not it is in any way harmful to humans. Phase one trials typically are 15 or 20 people. So it's a very, very small, very highly regulated approach. Phase two, we see few longer trials and trials with larger numbers of people until we get to phase three trials, which are these enormous trials with large and various kinds of people participating in research to determine whether or not a drug is effective. In the United States, we actually have phase four. It's not really that well publicized, but it is a fact that aftermarket, that is, after a drug has been approved for use, the Food and Drug Administration requires manufacturers to keep information about how that drug is working in the population. And that sometimes results in drugs, even after they've been licensed and labeled, being pulled from the market. One of the most famous ones in Alzheimer's was a drug called Tacrin back in the 1980s, which, by the way, the science for which was developed right there in your backyard at UCSD by a great guy named George Glenner, who's in heaven, I'm sure, right now. Anyway, human subject protection. It's a prime directive. It's the way it works. Whether it's consent, it's monitoring, there's adverse event opportunities to report any kind of a problem with any kind of a clinical trial, and then a measured stepwise approach to testing new treatment substances, particularly with drugs, but also with devices and infusions. Next slide. So what are some of the key vocabulary words that get thrown around? You may see an ad, particularly if you read a newspaper. Yeah, I know, Martha. What's a newspaper? It's this big piece of paper, many pieces of paper that are kind of folded together that have news in them. Anyway, I still read 2 papers a day, so I'm such a dinosaur. But you may see, if you do use a newspaper, you may see an advertisement for people to sign up and participate in a clinical trial. Clinical trial means, what is a clinical trial? It's a scientific test of a substance or a treatment in which some people are randomized. That is, some people will get the treatment, some people will get the ordinary standard of care, and those who don't get the treatment are often given a placebo, which literally means a sugar pill, so that we can make sure that what effect we see, whether it's improving people's thinking, reducing their agitation or apathy as symptoms of Alzheimer's disease, or whether or not they're going to develop true antibodies and fight COVID-19, people do get a placebo in the randomized clinical trial, so we can make sure that as much as we possibly can, that the active substance of the drug or the vaccine is actually what's causing the change. Other key vocabulary, I've already mentioned that we have phase 1, 2, and 3 clinical trials and a phase 4. And then this fancy phrase that shows up all the time in the jargon that is the business of participating in research: inclusion and exclusion criteria. Inclusion criteria say these are the kind of people that we want to include in our clinical trial. Exclusion criteria are just as it would be just the opposite. These are the people that we don't want in our clinical trial. Interestingly, again, to be personal here for a minute, I am excluded because I have to treat my polycystic kidney disease. I had the miracle of a kidney transplant from, thank you, little brother, 17 years ago, if you can believe that, and still running really well. Anyway, I am excluded from almost all clinical research in kidney disease because I'm cured with a transplant. That said, so those are my exclusion criteria. I'm also frequently, you'll see exclusion criteria that are based on age, occasionally on gender, or prior medical history, or drugs that are prescription drugs or over-the-counter substances that people are already taking. Inclusion criteria then would be, again, the opposite. They were looking for certain kinds of people, but in terms of an age range, gender, prior medical history, and so on. So these are some of the key vocabulary words that get tossed at us. It is highly technical language. I don't think you can make it any better, but I think we can try through this little talk to equip you with at least what some of the basic vocabulary is, so when you do volunteer and somebody says, well, you could end up randomized into getting the active substance or the placebo in this phase 3 clinical trial, you might have a little more understanding of exactly what those words are they're throwing at you. So moving from key vocabulary on, I would just say it's our belief that you or we are vital to progress, particularly in Alzheimer's disease research. Globally, I think there is no more bigger barrier to progress on Alzheimer's and dementia research than the fact that at any given day, there are over 70,000 vacancies in clinical trials and other research of all kinds into Alzheimer's disease and related dementia. Communities of color and persons in lower and middle income countries are particularly underrepresented in research. And it is such a concern, particularly in the United States context, that the National Institute on Aging, which is somewhere around $40 billion of your taxpayer money that goes to work looking into all areas of aging-related research, has made diversity in clinical trials, improving the diversity of the clinical trials and research that they sponsor, their number one priority for the next 5 years. One thing we've discovered in promoting and consulting on promoting participation in research is that one of the big differences in the Alzheimer community compared to other medicine is that primary care physicians, under enormous time constraints, also don't encourage participation of research in Alzheimer's disease as a standard of care. And that's why we go to community organizations like the Southern Caregiver Resource Center, and others to be the mediators, to be the ones to be encouraging people to participate in research. Primary care physicians perhaps don't know how to refer somebody to research. We've also heard over and over again, because there have been so many failed clinical trials in Alzheimer's disease, and the fact that it will take the caregiver and the person with dementia time and effort to participate in trials, that it may not really necessarily be worth the hassle. Sadly, because if you have a cancer doctor, it's really clear that participation in clinical trials and encouraging participation in clinical trials in the cancer field is a standard of care. It's not yet in brain health, but we might see that changing soon. Alzheimer research centers sometimes create barriers too. These can be anything from uh, language and cultural barriers to the physical barriers to participating in research. One of our sneaky little consulting things that we do is called secret shopping. When we're working with a research center who is having difficulty getting volunteers to participate, we will actually send somebody to the research center and walk their way in from the parking lot all the way into the middle of the building, where you find a sign that's about this big in small letters that says Alzheimer's Research Center. We will walk that walk, and we have found difficulties with parking, difficulties in security guards not knowing where to direct people. Signage is a never-ending problem. So these are some of the physical barriers that we see that inadvertently research centers create. And we also have seen some kind of psychological barriers where it really is intimidating to find your way around some of these big research centers like UCSD. So it's something to think about. It's something we encourage research to think about. And we also encourage researchers to think about coming out to the community to conduct some of their research. We right now are funded by the National Institute on Aging, and we're working in Syracuse with the Black community in Syracuse, New York, as well as a very multicultural community in the Bronx in New York City. And we're bringing the research participation and opportunity right out to hosting community organizations, as opposed to flipping it around and pushing the person who wants to participate in research to go find their way to the big scary medical center to participate in research. We'll see if it works, but we're pretty encouraged by some of the activities that we've seen in the last year. Last, and I think this is again something that we all need to think about as consumers, but there is a menu of opportunities as opposed to just one trial approach to getting people to participate in research. So that instead of just focusing, we encourage people to think about, instead of getting your heart set on a particular clinical trial and then not being able to participate in that, you say, well, I tried. We would encourage you to look at a menu. We look at a different options that there may be. And as I pointed out earlier in the slide deck, it's everything from on and offline surveys to the highest forms of treatment and everything in between. But I would leave you with nothing else but this, that progress in Alzheimer research, it's vital that we get more people and more diverse people participating in research. Last editorial point about diversity. In the United States and in other highly developed medical care system countries, we are beginning to see the development of what is being called personalized medicine. That means more and more individualized to the individual treatments of particular disorders. If we don't see more diversity in participation in research, those more and more personalized types of treatment for diseases, including Alzheimer's disease, will be out of the reach of people of those cultural and linguistic communities. Let me say it in English. To the extent that we have diverse people volunteering to participate in research that is yielding medicine that is more and more tailored to us as individuals, there is a risk that those communities will be cut off from progress in medicine, and that would be a shame. I recently, and I think this has got everybody's attention, the recently licensed amyloid plaque removing drug Aduhelm had clinical trials that had fewer than 5 people of color in their final clinical trials. And many clinicians who have looked at that drug have said, I think it's too risky to use that treatment drug on people that were so underrepresented in the trial. And that's what we're talking about as we move to more and more progress in personalized medicine. People will be left behind. So you're vital, we're vital. It's important to consider participation in research. So last slide. My people are Irish Catholic. So I've done a lot of work with tribal people, American Indians, in the last couple of years, and people are always curious what tribe I belong to. I belong to Irish Catholics. My Irish Catholic grandfather used to say that the way the rocks got cleared from the fields in Ireland is that everybody moved a stone that they could handle. Now, if you've never been to Ireland or known anyone that's Irish, let me just tell you, if rocks were money, the Irish would be the richest people on earth. We're not. So listen to my grandfather again. In clearing the fields, everybody can handle a rock that's their size. And I think research, I'd like to think about participating in research is that way. If you're homebound as a caregiver and can only do something that's online or a phone survey, that's the rock you can pick up. If you're a person living with early stage dementia and you're able to get yourself and get transportation to and from participating in a a device or a substance clinical trial, good for you. If you can test something online, increasingly during COVID, a number of the caregiver interventions in Alzheimer's, the caregiver support and education and interventions for Alzheimer caregivers moved to being delivered online, and therefore to deliver them with some validity online, they've gone into clinical trials that are online based. So there's, again, pick up the rock you can, join the fun, join the fight. That would be my message. Last slide. So where can you sign up? Let me just point out that, next slide. This is a list, and these slides, I guess, Martha, these slides or this information will be available after this talk, both in the talk as well as at the Southern Caregiver Resource Center. But you see here, this is a list of registries where you can put your basic information and receive information about clinical trials that might suit you. Trial Match is run by the Alzheimer's Association. There is also a searchable database for the less frightened of you of masses of data. Clinicaltrials.gov is the repository of all the clinical trials of all kinds that are being sponsored in the United States at this time. And you can identify and find your local Alzheimer's Disease Research Center, although many of you may know that it is at UCSD, by going to that last website. So this is part of how you can find where you as a person can participate in research. In addition, next slide, we're working right now with UCSD with an Alzheimer's Disease Research Center. This is a study for persons 50 to 83. There's your inclusion criteria. There are people that have to have a diagnosis of Alzheimer's disease. And this is a test of a clinical drug that someone will receive for 24 weeks free of cost. It's called the Biomarker Predictors of Memantine Sensitivity in Patients with Alzheimer's Disease. Oh my God, could it be a longer title? Yeah, it probably could. But as you see here, you have the name of the investigator, you have the website, you have all the basic information to contact. And this ad has been running in Facebook as well as on traditional media in the San Diego market. If you're interested, this is This is a study in the San Diego market. Next slide. I would also mention the LEAF study. This is one of those studies that has taken LEAF, which is a caregiver education and an emotional support program. If you're familiar with things like Savvy Caregiver or REACH or other of the evidence-based offerings of Martha's organization, it's similar to those, except that it's now being clinically studied. This is one that is this LEAF family caregiver study has transitioned from LEAF in person to LEAF online, and they want to make sure that they get the same results. Last study that we want to just expose you to right now is a study, next slide, about music and dementia. This is open to people with Alzheimer's or mild cognitive impairment. So see these inclusion and exclusion criteria, the fine print, really worth looking at. Men and women with Alzheimer's and mild cognitive impairment, 55 and older, with a study partner. You see that very frequently. This is a New York-based online study of how a music experience helps improve the lives of people with Alzheimer's disease or mild cognitive impairment. Next slide. Well, there's our contact information, and I think it's time to play questions and answers. Martha, there you are.
Mike, this was so interesting. I was taking a ton of notes on paper because I'm very old school as well when it comes to books. I have to hold the books, flip the pages. That is my happy me time. But this was so thank you so much, Mike, because I think for caregivers, especially caregivers who are really in the thick of things, when you hear the clinical trials, it's just this overwhelming concept of where do you start? How do I, even incorporate such an activity into my busy lives already? So I love how you broke it down and how you made it very simple to just really understand and be familiar, like you said, with those terms. So I do have a couple of questions that have been coming in from our audience, and I know that as someone who works with our clients, especially those who are caring for someone with Alzheimer's, dementia, or memory loss, involving the caregiver is imperative. Really, the caregiver is also who needs to understand not just the person with the disease, but the caregiver, because the caregiver is often going to be the person who drives that individual or fills up, the paperwork and all of that and explains it. So I like how, some of these studies welcome the participation of the caregiver in, at least in the concept of involving them. So we have our first question that kind of goes along with what I was just saying. Um, this person is saying, can someone with dementia participate too? And what would a typical role of the caregiver be in that case?
So we're seeing this evolve. Um, Alzheimer research is moving earlier and earlier and earlier in the disease. And I would say that many protocols, that is the recipe for studies, insist on a live-in caregiver as one of their inclusion criteria. One evolution we've seen as studies have moved to more and more early disease is that the caregiver doesn't necessarily have to be a live-in 24/7 caregiver. So that's a small evolution that I think is changing. We're also seeing people who are living with dementia who live alone put up a fuss that they are in fact willing and able to manage some of their own decision making and some of their own ordinary things like transportation and keeping their lives going, and that they should be able to be relied upon to talk about their symptoms and to keep track of whether or not they take medication. So I think it's an area where it's evolving. I think the traditionalists would say you can't do a clinical trial without an informant, because you can't trust a person with a brain disease to necessarily give you the most accurate information or to be safe in case there is an adverse event. So I think it's an area where it's evolving just like the field of Alzheimer's is evolving. My guess is people without a caregiver will typically not be able to be involved in great numbers in clinical research studies of substances. I think that door is still pretty closed, but that means other possibilities. That means
And
other
that's why
possibilities.
I think this is so important for our audience, if they're caregivers, to really learn as much as possible so that they're able to educate themselves in these processes, in these clinical
Yeah.
trials, so that they support the care receiver. I have another
Well, and
question,
and
and I Mhm.
right. We're trying to encourage science centers to present this menu, so that if
Yes.
somebody gets up the courage to participate in research, um, isn't it a shame to turn them away with nothing? So we're
Hmm.
really trying to encourage the research centers to not just recruit on a one trial and out basis and say, well, you don't fit the criteria, but instead, if you don't fit this trial, present people other options.
Mm.
It doesn't
Yeah,
always
that's a great
happen, but
idea.
I think that's a sign of progress. Sorry, Martha, I cut you off. Next
No, no,
question.
that's a great idea. Yes, the next question. You talked about the Black and Latino community and really needing for those communities to really get involved because, like you mentioned earlier, if we don't have enough participants, then we don't know what, if any, repercussions, whether they're good benefits, come out of these studies. And one of the questions here that I have is, why would a drug affect a person of color differently?
Genes. I mean, the genetic makeup my simplest answer is genetic makeup. Um, and as we get to more and more medicine that is built on genes, that's where personalized medicine is going. Then it's going to that's one important difference. I think also. Um, I mean, maybe that's too simplistic an answer, but I think that's my simple answer is genetic makeup. One specific place where genetic makeup makes a difference is how with people with different genetic makeups, how their bodies process drugs.
Mhm.
I know that's a big difference between different racial groups in terms of how the body I'm missing a word right now. I was going to say synthesizes, but that's not the word. But anyway,
Well,
how we process the drug.
and I think we saw that, Mike, with the COVID vaccine, right? Or actually the virus, that certain groups were being affected differently than others. And especially if there are any other underlying conditions, right? We saw that people with underlying conditions, chronic, diseases, were more susceptible to this virus and therefore fall ill at greater levels than a person who might be otherwise, quote unquote, healthy or normal. And I think that's what we need to consider, that yes, as the genetic makeup is different for every group, also the access to care and the history of that care of that group. I think that's important too. The education related to that access to care. So it's important, if any of you are out there who fall in these categories. I know, living in San Diego, especially, it's important that you become involved and get more education. As it relates to clinical trials, Mike, we have a couple of questions here. And one of them is from an audience member who is saying, if you volunteer for a clinical trial, can you find out the face of that clinical trial?
Absolutely, that's part of what will be first of all in the advertisement or in any conversation before you come in for informed consent. You don't see a lot of direct to public recruitment for phase one trials. So typically a trial particularly in Alzheimer's is either going to be a phase 2 or phase 3 clinical trial. Um, just given the nature of who can and can't do the highly regulated, highly monitored phase 1 trials. But that's absolutely an item that's in the informed consent.
Okay. And kind of a segue to this one, or I should say a follow-up, is if for drug clinical trials, do volunteers find out whether they receive a placebo or not?
They do. It's called, at some point in the data collection, the data becomes what's called unblinded. That is, even the investigators don't know who's got a placebo and who's got an active treatment while they're in the 24 weeks of the clinical trial. So sometime in the process of the clinical trial, there will be everybody will have been recruited in 50 sites. 300 people have been there through their 24 weeks. And at some point, the data become unblinded. And then there is an option for people who have felt they've had a benefit from, or that they've measured that they've had a benefit from an experimental treatment, to continue that treatment on what's called an open label extension. So in the case of Alzheimer's disease, tau tangles are part of the physical changes in the brain, and there is an anti-tau drug that for the people that got active drug after a year, when they filled out the trial and stopped the actual clinical trial and started analyzing the data, they were allowed, people that had a change because they were taking the active drug, were allowed to stay on the drug through an open label extension, even though the drug had not yet been licensed. So there's a lot of compassion, I guess I would say. There are a lot of compassion in the FDA processes when people are in those kind of trials.
I mean, it makes sense, right? It's you're dealing with a human, so of course that part of it is important. So here's one from a caregiver who is asking, if my dad joins the research study, how will I know he is safe? How is the safety of the participants protected? And I think that's a
Well,
valid question from a lot of caregivers.
yeah. Well, and I think that, as I said, I think it starts with informed consent. People with moderate to severe dementia probably cannot give their own consent. So a caregiver might be involved in giving in the consent process directly because they have a healthcare proxy or other instrument, such as a durable power of attorney for healthcare. They may actually be the one signing the consent documents, although there is a process that scientists use or science centers use to get the assent of and to really probe the assent of the person. So you just can't sign up dad for research if dad is protesting participating in research. It just doesn't work that way. So there's the informed consent process that's time consuming, that has an awful lot of information that is provided to the caregiver. And then if things, as I mentioned before, there are 24-hour call centers if there are adverse events. There are regular visits to the clinic. I mean, typically in a 24-week Alzheimer clinical trial, such as the one I put up about UCSD, folks who, after their initial visit to the clinic, will probably go to the clinic every 6 weeks. So they're going to have a medical checkup on how things are going. That may involve, depending on the drug, may involve blood work or other analytical work for the individual to make sure that there's nothing going wrong while we're fixing their brain, that we're not breaking their liver. That would be bad.
That
So I
would be
think that
bad.
medical monitoring, yeah, I think that medical monitoring is super important and well built into the clinical trial protocols, which is why they take time and money.
Absolutely. And this is why this conversation is so important. And I'm so glad that we're doing this together, Mike, because, a lot of us don't even know where to begin. We want to get involved. We understand the importance maybe of participating, but we don't know how to get involved. And in what you did today, I hope was kind of educate us a little bit more, give that clarity and a little bit more of where to connect. Any last tips, messages that you want to leave the audience before I conclude, Mike?
No, if anybody's particularly interested in the San Diego study, you've got my contact information there or the study contact information there. I wish I was in San Diego, although it's a beautiful fall day here in Columbia, Maryland. It'd be much more fun to do this in person, but I'm glad we can do it through the magic of live stream. And I appreciate your support and your friendship, Miss Martha. You and Roberto are a couple of my big heroes out there. So
Oh.
thank you.
Well, thank you, Mike. And maybe we can put up your contact info on the screen one last time in case anyone wants to
Sure.
connect. And this is where I encourage anyone who might be interested. Like Mike said, there are several clinical trials out there, research opportunities for you to participate in, and I'm sure they would be willing to connect you to some of those. I want to thank Mike and Recruitment Partners and Splaine Consulting for being here today and sharing all of this information. I want to encourage all of our audience members that if you know anyone who is caring for someone with Alzheimer's, dementia, memory loss, some sort of chronic condition, make sure you contact us, and we're here to support you and offer you services for free, support groups, classes on how to manage those difficult behaviors, counseling. Everything we do is free, and we have a whole inventory of online classes and webinars and podcasts and tip videos, and it's all there for the family and for the caregiver and for the care receiver. I also want to encourage you, if you found today's talk informative, we're going to have another one. We are going to get to see each other again, Mike. We will be
Good.
here on next Wednesday at on November 10th from 5 to 6 in the evening, in case somebody that you know of might be able to join us later in the evening. And again, we're encourage everyone to RSVP. Those who RSVP, I think the first 30 participants, the first 30 registrants get a gift. It's always good to get something for free, right? Especially in this day and age when it's nice when somebody thinks of you. But really, we want you to join us. We want you to be part of this discussion. So again, let us know how we can help you. Our number 858-268-4432, and our website is right there on the screen. Mike, it's been a pleasure. Virtual hugs your way. Stay safe, be well, and we'll see you soon. Thanks, everyone.